procedures can be combined with rhinoplasty. Rhinoplasty is great because it can be combined with almost any other surgical procedure. There's very few things that you can't do at the same time as rhinoplasty. There are some people, meaning some surgeons, that will not like to do rhinoplasty and lip lift at the same time because of the way that the incisions are placed. Personally, I don't like to do rhinoplasty that have alar base reductions at the same time as lip lift, but this can be done, and usually in a staged procedure. If you do it in a certain way, you can do it at the same time. But the answer is you can do just about any surgery with a rhinoplasty. Can you do a lip lift and a rhinoplasty at the same time? You can do a lip lift and a rhinoplasty at the same time. It is up for some debate amongst some surgeons because the incision can either be placed at the same place, which is at the bottom of the columella or this middle part of the nose where they share this incision, or you can have two separate incisions where the rhinoplasty incision is at the mid portion of the columella and the lip lift is the bottom portion of the columella. There is a lot of scientific literature supporting the two separate incisions as well as the single incision, and that they are safe to do either way. So you can do a lip lift and a rhinoplasty at the same time. For me, what it becomes a little bit more complicated is if you're doing alar base reduction with rhinoplasty and lip lift, because all of those are sharing the same incisions. This may take a little bit longer to heal, although it can be done. Is it better to get multiple plastic surgeries at once? This depends on you and what your goals are and what you're looking for with these surgeries. There is an advantage of doing multiple plastic surgeries at once because you are put to sleep once. If you're using general anesthesia, you're woken up once. You have that same time to pay for as far as the OR and anesthesia cost, as opposed to doing that multiple times. With any procedure, there are risks, and there are risks with anesthesia, although very, very slim and very small, they do exist. And so less times under anesthesia is less risk for you. Or one of the big reasons people will do multiple plastic surgeries at the same time is recovery. Then you have one recovery time. You're not having to recover multiple times for different procedures. Also, if you travel for plastic surgery, it is advantageous to do that all at once, and so you're not having to make multiple trips for these surgeries. For other people, surgeries are sort of scary. They can be anxiety provoking, they can be expensive, and there are reasons why people will choose to separate their surgeries so they're easier for them to manage for whatever reason. Most of my patients do get multiple plastic surgeries all at the same time for all of the reasons that I said. Can you have 3 surgeries at once? You can have 3 surgeries at once. The limitation would be how long these surgeries are. If these are 3 very long surgeries, that may amount to a time under anesthesia that will be a little bit too long or something that we wouldn't necessarily want to do. But if they're 3 shorter surgeries, that is definitely something that can be doable. This also depends on which surgeries they are. Are they surgeries that can be done at the same time with other ones, or these are ones that should only be done by themselves or in different combinations? Depending on which surgeries you're looking at, you should discuss this with your plastic surgeon prior to having surgery. Have questions? Schedule a consultation today at drangela.sturm.com. Thanks for watching.